Now, good health. When you have a medical question, do you call your doctor or do you get an online consult from Dr. Google?
A new survey finds a significant number of people turn to Google. Dr. Frank McGeorge is here with the pros and cons of getting a diagnosis from a search engine, and I am guilty, especially now that I have a baby. I'm always Googling.
And what could go wrong, really?
Right, what could go wrong, Kimberly and Devin? Well, you know, in point of fact, years ago, medical knowledge was hard to come by. Well, now a medical opinion, as Kimberly has found, is just a few clicks away. In the ER, I have seen both the good, it makes people more empowered to understand their health, but I've also seen the bad. People are often led astray by misleading sources, making the doctor's job much harder. Have you ever checked with Dr. Google before you go to your doctor?
Facts. Yes, I have.
Have you ever checked online for symptoms before you see your doctor?
Of course. Yes.
In fact, the survey done by Eligibility.com suggests as many as 89% of people Google their symptoms before going to a doctor. Now, often people simply wanted to see how serious their condition might be, and in most cases, there's no harm in that. In fact, when the group used Google Trends to analyze the most common symptoms searched, they were generally harmless. Stress was the most commonly searched symptom in 1/5 of states. In Michigan, the most commonly searched symptom was a stuffed nose. But in other states, symptoms like a stomachache or symptoms of E. coli could be related to more serious conditions. People have been known to Google potentially serious symptoms like chest pain or passing out when they should have been calling an ambulance or going to the ER. Taking the time to use an online symptom checker can help you understand when you should be seen urgently, but if you feel truly horrible, it might be a dangerous detour. Whatever conclusion you come to after looking online, if any serious conditions are still listed as a possibility, you should see a doctor to be sure you aren't overlooking anything critical.
Our doctors obviously go through a lot of training to do what we do. Online searches can be a helpful start, but make sure that you keep an open mind when you see your doctor. Oftentimes, I've seen people who've become so overly focused on a specific diagnosis that they ignore other important testing or recommendations.
You've been at this long enough to remember when there was no Dr. Google. I'm wondering your thoughts on how this has changed things.
Well, you know, when I started, there was literally no internet. Now, most patients really had no idea what was wrong at that point in time. Well, now patients do come in much better informed, which means doctors have to spend more time understanding what the patient knows and correct misunderstandings if there are any. The approach is really just different now, and it is much more collaborative, which I think is really a good thing. Sure. It's just a new era. We need to evolve to the realities.
What'd you search today?
5-month-old snotty nose. How do you treat it? Saline drops.
Saline drops.
Saline drops. Good deal. Yeah. All right.